Hello, my name is Cortland Burgess, and this is my presentation of my APRN interview. For my APRN interview, I had the pleasure of interviewing Tiani Tuck. She is a practicing family nurse practitioner. I want to start this presentation with an explanation of the image I created. My interview with Miss Tuck took place in the comfort of her own home. We had a couple of additional guests for our interview, her sweet daughter and dog. The circles coming down represent glitter. Her daughter was entertained during our interview by Sparkle Play-Doh. Part of the interview involved the discussion of the difference between glitter and sparkles. This conversation made me smile. I enjoyed a glimpse into her home life and was reassured by the simplicity of the daily activities taking place. Miss Tuck is also currently pregnant with their second child. Again, this was a comfort to me as we are expecting the arrival of our sweet girl any day. This interview not only provided me with great information, but also reassurance that achieving and maintaining my career goal is possible while fulfilling my dream of being a mom and having a family. Miss Tuck's educational background consists of a few degrees. She initially obtained her Bachelor's of Science in Psychology from Missouri Southern State University. She was involved in collegiate volleyball, and a degree in nursing was not an option due to her athletic schedule. Her original plan post-graduation was to pursue counseling, but quickly realized she didn't like the job. She then went on to attend the University of Missouri and completed their accelerated BSN program in 18 months. In order to enter this program, you must hold a bachelor's degree in another field. After 2 years of work, she returned back to school to pursue her Master's of Science in Nursing through UMKC, a hybrid program that offered a location in Joplin, Missouri at Missouri Southern State University. The program consisted of one on-campus day per week. She enjoyed the on-campus school day as it allowed her to meet her cohort and create a system of support and encouragement. Her MSN program was 3.5 years on the part-time track, and she graduated with her MSN in December of 2013. Along with her educational degrees, Ms. Tuck is a certified family nurse practitioner by the American Academy of Nurse Practitioners. Ms. Tuck's work history consisted of after graduation with her BSN, she returned home to Joplin, Missouri, and worked at Freeman on the medical oncology floor for 2 years. After 2 years of work, she decided to return to school to continue her education with her Master's of Science in Nursing. She said that continuing her education was never her plan from the beginning, but while she was working, she felt that she could do more with her career and decided to jump right into her MSN. While pursuing her MSN, she began working at a radiation oncology office. She worked full-time for 6 months, then realized working office hours was difficult to balance with clinical requirements, so she transitioned to a PRN status and worked part-time hours. After obtaining her MSN, she began work at an internal medicine clinic in Bella Vista, Arkansas. She worked there for 1 year and then began working at her current place of employment, a family medicine office in Webb City, Missouri. Ms. Tuck's current position as a full-time family nurse practitioner at the Mercy Clinic Family Medicine Office consists of 2 work environments, the Family Practice Clinic and the Walk-in Clinic. The Family Practice Clinic consists of a patient population that she referred to as cradle to grave, although she does not have much exposure to pediatric patients. She works with patients who have chronic diseases such as diabetes, hypertension, and cholesterol issues. She does 6-month medication visits and some wellness checks. At times, she sees acute cases as her collaborating physician sees patients for their annual appointment. The Family Practice Clinic consists of Monday through Friday, 8 a.m. to the last appointment being between 3:15 and 3:45 in the afternoon. Most days she does not leave the office before 5 as she wraps up her day with charting, checking her in-basket test results, and preparing for the next day. I remember when I job shadowed her, she creates notes for each appointment for preparation for the next day. As this creates more work for her, it ensures her to feel more prepared and has a smooth workflow. She includes test results and what was discussed at the prior appointment. The walk-in clinic is a different beast and a challenge for her, but she feels it has molded her into being a better nurse practitioner. The care at times is more procedure-based, such as simple INDs or toenail removal. The focus in the walk-in clinic is more, what can I do for you today right now? This is a challenge for her due to her being detail-oriented. Working in a walk-in clinic has taught her that working in an urgent care setting or emergency room is not her cup of tea. If working in the walk-in clinic on a weekday, the shift is 12 hours, 7 a.m. to 7 p.m. The nurse practitioners rotate walk-in clinic duty every 6th weekend with hours of 10 a.m. to 6 p.m. The nurse practitioners are not required to take call, although the nurse practitioners in the clinic keep an open line of communication to offer support and serve as a resource for the nurse practitioner working in the clinic that day. The physicians do phone on-call during the weekends to serve as a resource. On the weekend, the walk-in clinic staff consists of a nurse practitioner, APRN, and a lab radiology personnel. Ms. Tuck learned of her current position through a fellow nurse practitioner she met during her master's program. They had become friends during the program and remained in touch post-graduation. The nurse practitioner was currently working at the family practice clinic and notified Ms. Tuck of the position. There is something to be said about knowing people and networking. Mercy within the past couple years has transitioned from a set salary to a production-based salary. The base salary for family nurse practitioners is $80,000. The $80,000 is reflected in the bi-weekly paycheck. Additional pay is production-based and paid out in quarterly bonuses. Providers must meet a quarterly requirement of RVUs to ensure their base pay of $80,000. RVU stands for Relative Value Unit. Each patient visit is an RVU. Some visits are coded at a higher cost and reflect a higher RVU. Her clinic breaks down the quarterly RVU requirement to a monthly requirement to ensure they stay on track. Nurse practitioners must meet 250 RVUs per month. Each additional RVU is worth $5. She reports that some people have mixed feelings on the production-based salary. Some feel that it pins the nurse practitioner and the physician against each other as they both have patient visit requirements they must meet. She reports she does not experience this in her office due to their busy schedule. If for some reason she would need to catch up on RVUs, she could do a couple of visits in the walk-in clinic. Ms. Tuck reports her mentors have varied throughout her career. Post-graduation from her MSN, she kept in touch with her preceptor, which offered her great encouragement. During her first year of practice as a nurse practitioner, she met two nurse practitioners. One had been practicing for 20 years and one for 5 years. They served as a wonderful resource with different depths of knowledge and wisdom to offer. Currently, her biggest resource is her collaborating physician and fellow nurse practitioners and physician assistants. She feels that not having a set mentor may be a weakness. I feel that having a mentor is a wonderful resource, but her comfort with her collaborating physician and fellow providers is a definite strength. Recent changes and regulations she has encountered in her practice are due to the opioid epidemic. While she does not have her DEA, Drug Enforcement Administration, in Missouri, she cannot prescribe controlled substances. Her collaborating physician has patients who are prescribed controlled substances. She has experienced new regulations such as pain contracts, drug screens, and short-term insurance coverage for a new pain prescription of only covering a 7-day supply. An institutional policy change she mentioned was the transition to a production-based salary. Ms. Tuck reports a mix in attitudes when it comes to nurse practitioners. Some patients have a strong opinion and demand to see a physician, while others are much more accepting of seeing a nurse practitioner. In her clinic, the physician does a pop-in visit with patients that are resistant to nurse practitioners to provide the patient with reassurance. She reports that once a patient has experienced a visit with a nurse practitioner, she rarely sees the resistance continue. The clinic receptionists also play an important role in encouraging patients to see the nurse practitioners, explaining that their services are available and at times their schedules are more available as well. Some patients favor nurse practitioners over physicians due to their quality time spent with patients. In her experience, nurse practitioners spend more time with patients and provide more education. This may be This may be due to a more care-based background rather than a science-based background. The phrases of wisdom portion of the interview was my favorite. Don't be afraid to ask questions. Train your patients. Help your patients identify 3 areas to focus on to ensure your appointment does not get monopolized with problems and no real ground covered. Listening is important to patients. And it's okay if you don't know something, but listen, display care, and formulate a plan. If a clear answer is not surfacing, let your patient know what you are thinking. Identify and list out the top 3 issues and where to start. She reports she may not always know the answer and may not always be able to help, but she will always listen and display care to help find a direction. Her words of wisdom resonated with me. I feel like her words of wisdom coincide with my goal of being mindful as a provider, focusing in the moment to hear what a patient is saying and display genuine listening. At times, a patient feeling listened to is just as important as providing an answer. Thank you for listening.